Hello, I'm here today to talk about something incredibly important for our health as we age, and that's movement and exercise. I want to address a common misconception right from the start. You may have seen headlines promising overnight fat loss or miracle exercises that replace everything else. As a physician, I need to be honest with you. There are no shortcuts when it comes to sustainable health and fitness. What I'm going to share with you today is something far more valuable than empty promises. I'm going to give you evidence-based information about exercises that are genuinely safe, effective, and appropriate for people 65 and older. Let me start by saying this. Age 65 is not a finish line. It's not the end of your fitness journey. In fact, for many people, it can be a new beginning. I have seen patients in their 70s and 80s make remarkable improvements in their strength, balance, and overall health. But the key is doing it correctly, safely, and with realistic expectations. First, let's talk about what actually happens to our bodies as we age. After about age 30, we naturally begin to lose muscle mass, a process called sarcopenia. By age 65, if we haven't been actively maintaining our muscle through exercise, we may have lost a significant amount of our lean muscle tissue. This affects not just our strength, but our metabolism, our bone density, our balance, and our ability to perform everyday activities. The good news is that resistance training and proper movement can slow, stop, or even reverse much of this muscle loss, regardless of your age. Now, when it comes to exercise and weight management, I need to set realistic expectations. No exercise, no matter how effective, burns fat overnight. Fat loss is a gradual process that occurs when we consistently maintain a caloric deficit, meaning we burn more calories than we consume over time. Exercise is absolutely valuable for this process, but it works in combination with proper nutrition, adequate sleep, stress management, and consistency over weeks and months, not overnight. That said, there are exercises that are particularly valuable for people 65 and older, and I want to focus on movements that give you the most benefit for your time and effort, while being safe for your joints and appropriate for various fitness levels. Let me talk about resistance training first, because this is absolutely crucial as we age. When I say resistance training, I don't necessarily mean lifting heavy weights at a gym, though that can be appropriate for some people. Resistance training simply means working your muscles against some form of resistance, whether that's your own body weight, resistance bands, like dumbbells, or even household objects. One of the most functional and beneficial exercises for older adults is the sit-to-stand movement. This is exactly what it sounds like, sitting down in a chair and standing back up. You do this movement dozens of times every day, and maintaining the strength to do it easily is essential for independence. Here's how to make it an effective exercise. Sit in a sturdy chair with your feet flat on the floor, about hip-width apart. Cross your arms over your chest so you're not using your hands to push off. Lean forward slightly from your hips, then push through your heels to stand up. Lower yourself back down with control. That's one repetition. Start with as many as you can do comfortably, perhaps 8 to 10, and gradually work up to 3 sets of 10 to 15 repetitions. As this becomes easier, you can make it more challenging by using a lower chair, holding a light weight at your chest, or pausing at the bottom position. Another excellent exercise is the wall push-up. Traditional floor push-ups can be too challenging or inappropriate for many older adults, but wall push-ups provide similar benefits while being much more accessible. Stand facing a wall at arm's length. Place your hands on the wall slightly wider than shoulder-width apart. Keep your body in a straight line from head to heels, and slowly bend your elbows to bring your chest toward the wall. then push back to the starting position. This strengthens your chest, shoulders, and triceps, which are important for everyday activities like pushing shopping carts, getting up from the floor, or opening heavy doors. Balance exercises are equally important, if not more so, as we age. Falls are one of the leading causes of injury and loss of independence in older adults, and improving balance can dramatically reduce fall risk. A simple but effective balance exercise is single-leg standing. Stand near a counter or sturdy chair that you can hold onto if needed. Lift one foot just a few inches off the ground and try to maintain your balance for 10 to 30 seconds. As your balance improves, you can progress to doing this without holding on, closing your eyes, or standing on an unstable surface like a pillow. Alternate legs and repeat several times on each side. Heel-to-toe walking is another excellent balance exercise that also helps with coordination. Imagine you're walking on a tightrope. Place one foot directly in front of the other so that the heel of your front foot touches the toes of your back foot. Take slow, deliberate steps in this manner for about 20 steps. Do this near a wall or counter initially so you can steady yourself if needed. Now, regarding cardiovascular exercise and the idea of forgetting running, let me be clear. Running is an excellent form of exercise for those who can do it safely and enjoy it. However, it's not the only option, and for many people over 65, it may not be the most appropriate choice due to joint concerns or other health conditions. The good news is there are many ways to improve cardiovascular fitness that are lower impact and equally effective. Walking is perhaps the most underrated exercise available to us. Brisk walking, where you're moving fast enough that you can talk but not sing, provides excellent cardiovascular benefits. It improves heart health, helps with weight management, strengthens bones, and can boost mood and cognitive function. The key is consistency and gradually increasing either your duration or your intensity. Start with whatever feels comfortable, even if it's just 10 minutes, and gradually build up to 30 minutes or more most days of the week. If you have access to a pool, water-based exercises are fantastic for older adults. The buoyancy of water reduces stress on joints, while the resistance of water provides an excellent workout. Water walking, water aerobics, or swimming are all excellent options that provide cardiovascular benefits and muscle strengthening with minimal injury risk. Let me also address something important: the duration and frequency of exercise. While short exercise sessions are certainly better than nothing, and consistency is more important than duration, the idea that 3 minutes of daily exercise is sufficient for significant health benefits or weight loss is unfortunately misleading. Current guidelines from organizations like the American Heart Association and the Centers for Disease Control recommend that older adults aim for at least 150 minutes of moderate-intensity aerobic activity per week, along with muscle-strengthening activities on 2 or more days per week. This doesn't mean you need to exercise for 150 minutes straight. You can break it up into smaller sessions throughout the day and week. 3 10-minute walks spread throughout the day count just as much as one 30-minute walk. Core strength is another crucial component of fitness for older adults that often gets overlooked. A strong core helps with balance, reduces back pain, and makes everyday movements easier and safer. But when I talk about core exercises for older adults, I'm not talking about hundreds of sit-ups or planks held for minutes at a time. Simple, gentle core exercises can be very effective. One of my favorites is the seated march. Sit in a sturdy chair with your back straight and feet flat on the floor. Slowly lift one knee up as high as comfortably possible. Lower it back down, then repeat with the other leg. This simple movement engages your core muscles while being very safe and accessible. Another effective core exercise is the standing pelvic tilt. Stand with your back against a wall, feet about 6 inches away from the wall. Gently tilt your pelvis to press your lower back against the wall. Hold for a few seconds, then relax. This strengthens deep core muscles and can help with posture and back pain. Flexibility and mobility work is the final piece of the puzzle. As we age, our muscles and connective tissues naturally become less flexible, which can limit our range of motion and make everyday activities more difficult. Gentle stretching, yoga, or Tai Chi can all help maintain and improve flexibility. These practices also offer additional benefits like stress reduction, improved balance, and enhanced mind-body connection. A simple daily stretching routine might include neck rolls, shoulder circles, gentle torso twists, hamstring stretches, and calf stretches. Each stretch should be held for 15 to 30 seconds without bouncing, and you should feel a gentle pull but never pain. Now, let me talk about safety considerations because this is absolutely critical. Before starting any new exercise program, especially if you've been inactive or have existing health conditions, you should consult with your healthcare provider. This isn't just a legal disclaimer. It's genuinely important. Your doctor knows your medical history, your medications, and any conditions that might affect what exercises are safe for you. When you do exercise, listen to your body. Some muscle fatigue and mild soreness a day or two after exercise is normal, especially when you're starting out. But sharp pain, chest pain, severe shortness of breath, dizziness, or pain that doesn't resolve are warning signs that you should stop and consult your doctor. The old saying, "no pain, no gain," is not only incorrect, it's dangerous, especially for older adults. Proper form is more important than the number of repetitions or the amount of weight you're using. It's better to do 5 perfect repetitions than 15 sloppy ones. Poor form not only reduces the effectiveness of the exercise, but significantly increases your injury risk. Hydration is important at any age, but older adults are at higher risk for dehydration. Drink water before, during, and after exercise, even if you don't feel particularly thirsty. Thirst sensation can decrease with age, so don't rely on it as your only indicator. Let me also address the elephant in the room. Weight loss and body composition changes at 65 and beyond. Yes, it is absolutely possible to lose weight, build muscle, and improve your body composition after 65. I've seen it happen countless times in my practice. However, it's typically slower than it would be for a younger person, and it requires patience, consistency, and a comprehensive approach. Weight loss fundamentals remain the same regardless of age. You need to consume fewer calories than you burn. But as we age, our metabolism naturally slows down. We tend to be less active, and we have less muscle mass, all of which means we burn fewer calories at rest. This doesn't mean weight loss is impossible. It just means we need to be more mindful and patient. A safe and sustainable rate of weight loss is about 1 to 2 pounds per week, and even that might be on the faster end for older adults. More importantly than the number on the scale, focus on how you feel and what you can do. Are you getting stronger? Is your balance improving? Can you walk farther without getting tired? Are your clothes fitting better? These functional improvements are often more meaningful than pounds lost, and they're what truly impact your quality of life and independence. Nutrition plays an equally important role as exercise in managing weight and maintaining health as we age. Older adults need adequate protein to maintain muscle mass, typically about 1.0 to 1.2 grams per kilogram of body weight. We also need sufficient calcium and vitamin D for bone health, fiber for digestive health, and a variety of fruits and vegetables for essential vitamins, minerals, and antioxidants. Extreme calorie restriction is not advisable for older adults as it can lead to nutrient deficiencies and accelerated muscle loss, Let me give you a realistic picture of what a good exercise routine might look like for someone 65 or older who is just starting out. On Monday, Wednesday, and Friday, you might do 20 to 30 minutes of strength training exercises like sit-to-stands, wall push-ups, and some core and balance work. On Tuesday, Thursday, and Saturday, you might do 20 to 30 minutes of cardiovascular activity like brisk walking. On Sunday, you might do some gentle stretching or yoga, or take a rest day. As you build fitness over weeks and months, you can gradually increase the duration, intensity, or complexity of these exercises. The key word here is gradually. Trying to do too much too soon is one of the most common mistakes I see, and it often leads to injury, burnout, or giving up entirely. Start where you are, not where you think you should be or where you used to be. If you can only do 3 sit-to-stands right now, that's your starting point. Next week, maybe you can do 4. Progress doesn't have to be dramatic to be meaningful. Consistency trumps intensity every single time, especially for older adults. It's better to do a moderate workout that you'll actually do regularly than to plan an intense workout that you'll skip because it's too challenging or time-consuming. Make exercise a non-negotiable part of your daily routine, like brushing your teeth. Find ways to make exercise enjoyable. If you hate an exercise, you're not going to stick with it long-term. Maybe you prefer exercising with friends, or listening to music or audiobooks while you walk, or exercising outside in nature. Maybe you enjoy the structure of a class or the guidance of a personal trainer who specializes in older adults. Whatever makes exercise more appealing to you, incorporate that into your routine. Finally, let me emphasize the broader benefits of regular exercise for older adults that go beyond weight management. Regular physical activity reduces the risk of chronic diseases like heart disease, stroke, type 2 diabetes, and certain cancers. It improves bone density, reducing the risk of osteoporosis and fractures. It enhances mental health, reducing symptoms of depression and anxiety, and potentially reducing the risk of cognitive decline and dementia. It improves sleep quality, boosts energy levels, and enhances overall quality of life. These benefits are available to you regardless of whether you lose a single pound. Let me expand on some specific scenarios and challenges that many people over 65 face, because I want this information to be as practical and applicable to your real life as possible. One of the most common concerns I hear from patients is, "I have arthritis. Can I still exercise?" The answer is yes, and in fact, appropriate exercise is one of the best treatments for arthritis. Movement helps lubricate joints, strengthens the muscles that support joints, and can actually reduce arthritis pain over time. The key is choosing low-impact activities and avoiding exercises that cause sharp pain. Water exercises are particularly beneficial for arthritis because the buoyancy reduces stress on joints. Range of motion exercises, where you gently move each joint through its full range of motion, can help maintain flexibility. Start slowly and warm up your joints with gentle movements before more vigorous activity. If you have severe arthritis or aren't sure which exercises are safe, ask your doctor for a referral to a physical therapist who can create a personalized program for you. Another common concern is recovering from surgery or a significant health event. Perhaps you've had a hip or knee replacement, heart surgery, or recovered from a stroke. In these cases, cardiac rehabilitation or physical therapy programs are invaluable. These supervised programs are specifically designed to help you safely rebuild strength and endurance after a major health event. Even after you've completed a formal rehabilitation program, the exercises and principles you learned there should become the foundation of your ongoing fitness routine. Don't think of rehabilitation as something that ends. Think of it as the beginning of a lifelong commitment to maintaining what you've rebuilt. Let's talk about osteoporosis, which affects millions of older adults, particularly women. Weight-bearing exercises are crucial for bone health. These are exercises where you're supporting your own body weight, like walking, dancing, or stair climbing. Resistance training also helps build bone density. However, if you have severe osteoporosis, you need to be careful with certain movements, particularly forward bending or twisting motions that could increase fracture risk. Your doctor can help you determine which exercises are safest for you based on your bone density scores. For those dealing with balance issues or a fear of falling, this fear itself can become a barrier to exercise. But avoiding movement actually makes falls more likely because you lose strength and balance even faster. The solution is to exercise safely. Always have something sturdy nearby that you can hold on to if needed. Consider exercising in a corner where two walls meet, giving you support on two sides if necessary. Remove tripping hazards from your exercise area. Wear supportive, non-slip shoes. Consider working with a physical therapist initially to build confidence. Some communities offer fall prevention programs specifically designed for older adults, which can be excellent resources. If you have heart disease or high blood pressure, exercise is not only safe but beneficial, but you need to approach it correctly. Your doctor may want you to have a stress test before starting an exercise program to determine safe intensity levels. You'll want to start at a lower intensity and progress more gradually. Pay attention to warning signs like chest pain, unusual shortness of breath, or dizziness, and stop exercising and seek medical attention if these occur. Many people with heart conditions benefit from participating in cardiac rehabilitation programs where they can exercise under medical supervision while learning how to exercise safely on their own. Diabetes is another condition where exercise is incredibly beneficial. Physical activity helps control blood sugar levels, improves insulin sensitivity, and reduces cardiovascular risk. However, if you take insulin or certain diabetes medications, you need to be aware of the risk of low blood sugar during or after exercise. Check your blood sugar before and after exercise, especially when you're first starting out. Carry a fast-acting carbohydrate source with you in case your blood sugar drops too low. Exercise at roughly the same time each day to help keep blood sugar more predictable. Work with your healthcare team to adjust medications if needed as you become more active. For those dealing with chronic obstructive pulmonary disease or other breathing conditions, exercise might seem daunting, but it's actually one of the best things you can do. Exercise strengthens the muscles involved in breathing and improves your body's ability to use oxygen. Start with very short sessions, even just 5 minutes, and very gradually increase duration. Pulmonary rehabilitation programs are specifically designed for people with breathing conditions and teach breathing techniques, pacing strategies, and appropriate exercises. Let me address the psychological and emotional aspects of starting an exercise program later in life, because these are just as important as the physical considerations. Many people feel self-conscious about exercising, especially if they're starting from a low fitness level or have gained significant weight. They worry about looking awkward or being judged. First, remember that everyone at the gym, in the exercise class, or walking in the park is focused on their own workout, not watching you. Second, there's absolutely no shame in being a beginner at any age. In fact, starting an exercise program at 65 or 70 or 80 takes courage and should be celebrated. Third, if the traditional gym environment doesn't appeal to you, there are many alternatives. Exercise at home with online videos, walk in your neighborhood, join senior-specific exercise programs at community centers, or find a personal trainer who works with older adults. Some people struggle with motivation, especially on days when they're tired or the weather is bad or they just don't feel like it? This is where having a routine helps tremendously. Exercise at the same time each day so it becomes automatic. Find an exercise buddy who's counting on you to show up. Track your progress in a journal or app so you can see how far you've come. On days when motivation is low, tell yourself you'll just do 10 minutes. Often, once you start, you'll end up doing more. But even if you only do 10 minutes, that's still infinitely better than zero. The goal is consistency over perfection. Others struggle with impatience. They want to see results immediately. And when dramatic changes don't happen in the first week or two, they get discouraged. This is why I emphasize that exercise is a long-term investment. The benefits accumulate over weeks, months, and years. Some changes, like improved mood and energy, might be noticeable within days. Others, like increased strength and endurance, become apparent over weeks. Body composition changes typically take months, but all of these benefits are worth the wait. And once you've built fitness, maintaining it is easier than building it from scratch. Let me give you some specific modifications for common exercises to make them accessible for different fitness levels. For the sit-to-stand exercise I mentioned earlier, if standing from a regular chair is too difficult, use a higher surface like your bed, or a chair with cushions added to increase the height. If it's too easy, progress to a lower chair. Add weight by holding dumbbells or a heavy book at your chest. Or slow down the movement, particularly the lowering phase, which increases the challenge significantly. For wall push-ups, if they're too difficult, stand closer to the wall so there's less resistance. If they're too easy, stand farther from the wall or progress to push-ups on a kitchen counter, then a sturdy chair, then on your knees on the floor, and eventually to full push-ups on your toes if that's appropriate for you. For balance exercises, if standing on one leg is too challenging, start by just shifting your weight from one leg to the other while keeping both feet on the ground. Then progress to lifting one heel slightly off the ground while keeping your toes down. Then lift the entire foot just an inch or two. The progression is gradual and should be determined by what you can do safely. Finally, I want to leave you with this thought. The best exercise program is the one you'll actually do. All the scientifically proven, perfectly designed exercise recommendations in the world won't help you if you don't follow them. So, as you design your own exercise routine, prioritize sustainability and enjoyment alongside effectiveness. Make choices that fit your life, your preferences, your abilities, and your goals. Be patient with yourself as you build new habits. Celebrate every effort, not just the outcomes. And remember that starting today, at whatever age you are, with whatever fitness level you currently have, is infinitely better than waiting for the perfect time or the perfect program. Your journey to better health and fitness begins with a single step, a single repetition, a single decision to move. Make that decision today, and then make it again tomorrow, and the next day. That's how sustainable, meaningful change happens. Not overnight, not through miracles or shortcuts, but through consistent, patient, evidence-based effort over time. And you absolutely have the power to do this. I've seen it happen countless times, and I believe in your ability to improve your health and quality of life through movement, regardless of your age.